June is Men's Health Month, and today we're discussing a common condition affecting many men as they age, benign prostatic hyperplasia, otherwise known as an enlarged prostate. With us is Dr. Daniel Heslop, a urologist with Mayo Clinic Health System. Good morning, doctor.
Good morning.
Thanks for being here.
Thanks for having me.
So yeah, just start by telling us, a little bit about BPH, what it is and how it affects the urinary system.
Yeah, so as a urologist, we address conditions that affect the urinary system in both men and women, as well as the reproductive system in men. And the prostate is an organ that is at the junction of those two systems in men. Its function is to contribute a fluid for the semen and the sperm that nourishes them, and it also has muscle in it that helps propel that fluid into the urethra. Now, as men age, the prostate enlarges, and oftentimes men can have symptoms associated with that enlargement.
Okay, and what are some of those symptoms to be looking out for?
Well, we like to divide them into obstructive symptoms and irritative symptoms.
Okay.
And obstructive symptoms are those symptoms such as having trouble starting your stream, a weak stream, maybe having to strain and your stream is inconsistent, it's intermittent, and you feel like you don't completely empty. Maybe once you get done urinating, you pull up your pants and you have some dribbling of urine afterwards. The other side of symptoms are the irritative symptoms. So maybe you go to the bathroom too frequently, maybe you develop the desire to urinate, and it's hard to quell that desire and you leak urine. And then some men get up multiple times at night to urinate.
Okay. And then any tests to confirm BPH, any screenings that you recommend men undergo, or what's the guidance there? Right.
So when we see a man in clinic for BPH, typically we start with a questionnaire. Common questionnaire that we use is called the AUA symptom score. It's a validated tool that assesses the different domains of the urinary symptoms, and it allows us to risk stratify men into low, moderate, and severe BPH symptoms. It also has a bother index question too, which to me is the most important question, because how impactful is this to your life? It's important for us to get an idea of how large the prostate is, and we can do that using a lot of imaging. So CT scans help us, MRI scans help us. If we don't have any of those, we can often do a transrectal ultrasound in clinic to get an assessment of the prostate size.
All right. What about treatment options?
Well, there are a variety of treatment options. First, we look at lifestyle or behavioral modifications that men can make. Maybe men are drinking too much fluids, or maybe they're drinking the wrong fluids. Things like caffeine, alcohol, bladder irritants, and they can cause more frequency and urgency. Maybe they have some medications that they're taking that can contribute to the urinary symptoms. Then the next thing is there are some medications that men can take. There's medications that relax the prostate or the bladder neck and make it easier for men to urinate. There's other medications that can shrink the prostate to some degree and also prevent it from getting bigger. We have medications that address the bladder-related symptoms as well too. So the bladder relaxants that address the frequency and urgency symptoms as well.
All right.
Then there are procedures.
Okay.
So we have procedures that can be done in clinic, sometimes without general anesthesia, and just a local anesthetic, minimally invasive procedures. And then there are larger surgeries that require maybe a short inpatient stay in the hospital.
And what do you recommend men do if they are experiencing some of these urinary symptoms?
Well, I think many men ignore this until it's too late. And as urologists, we deal with the urinary system. We like to think of ourselves as plumbers. And a nice analogy is if you have a blockage, don't ignore it. Don't keep pouring Drano on it. Call the plumber and deal with it.
Yes. And you are the plumber in this instance.
I am the plumber in this instance, that's right.
Okay. All right. Well, doctor, thank you so much for being here, for shining light on such an important topic.
Thank you for having me.
No problem. Stay with us. We're back right after this.